Hello and welcome to our T-Level Health Preparing for Year 2 delivery, aimed at teaching and delivery staff of the Health TQ. This session will focus on Year 2 and the delivery of the occupational specialism content. All information provided is correct as of April 24 and may not reflect future changes to guidance documents. Please always review the most up-to-date guidance. So today's aims and objectives. Today we are here to support staff in the delivery, planning and preparing students for assessment of the Year 2 occupational specialism content. We're going to identify approaches to curriculum planning, explore teaching and learning strategies and share best practice. So what is in Year 2? So for Year 2, you have a support and healthcare core, which is made up of 3 performance outcomes, and we have the occupational specific 3 performance outcomes based on which occupational specialism you pick. So for example, adult nursing, midwifery, care of children, mental health teams and support in the therapy teams. So your support and healthcare core is generic occupational specialism. So when teaching this content, this will be contextualized to all of the occupational specialism, a bit like Year 1, with the 3 performance outcomes that are specific to the OS contextualized to that vocational area. So, and how the knowledge, the specification looks, so the knowledge and skills criteria, how does that look in Year 2? So the knowledge and skills are structured side by side within the themes section, which is this grey box here. So you have your performance outcomes, you have themed sections within each performance outcomes, and then the knowledge and skills are sequentially numbered throughout. So K obviously denotes knowledge, S denotes skill statements. So the mandatory content, as mentioned earlier, encompasses 3 performance outcomes for the support and healthcare core, and 3 for the occupational specialism. So the example here we have is option A, supporting the adult nursing team. So just a reminder that these 3 performance outcomes, you can see these are general, they're not occupationally specific. Therefore, when delivering this content, you should be looking to contextualize to all occupational specialism. So for example, when exploring physiological measurements, you should link this into relation to adult nursing, but also in relation to, say, therapy teams or a child. So now let's explore the synoptic assessments in a little bit more detail. So this will give us an overview and then we'll explore in more granular detail later on in this session. So assignment 1, known as the case study assessment or CSA, is an external assessment lasting 4.5 hours. This assessment evaluates students' ability to analyse and respond to real-life case scenarios in a healthcare context. Assignment 2 is divided into 2 parts. Part 1 is the practical activity assessment core, an internal assessment with a time allowance of 1 hour to 1 hour 30 minutes. This assessment focuses on students' practical skills and application of theoretical knowledge in the general healthcare settings. Part 2 is the PA in relation to the occupational specialisms, or can be known as OPA. With a time allowance of 1 hour 15 minutes to 2 hours 15. This assessment provides students with the opportunity to demonstrate proficiency in specific practical activity relevant to their chosen healthcare occupational specialism. Now, just to note that the timings are 1 hour 15 to 2 hours 15. What this means is every assessment series, the timing will change depending on the practical activities for that session, but they will never go beyond the scope of what is presented here. So a minimum of 1 hour to a maximum of 1.5, for example, for assignment 2, part 1. Assignment 3, known as the Professional Discussion Assessment or PDA, is an external assessment lasting 1 hour with an additional 45 minutes of preparation time. This assessment evaluates students' communication skills, professionalism and ability to engage in professional discussions on healthcare topics. Overall, these synoptic assessments offer comprehensive assessment of students' knowledge, skills and professional competencies in the field of health, preparing them for future careers in the healthcare industry. The assessment timeline for health for the academic year 23-24 has been outlined. From April to June, the assessment windows run consecutively. These timelines are available on the key date schedule, providing clarity and guidance for both students and educators as they navigate through the assessment process. For the internal assessment timeline of health, several key milestones have been established to ensure a smooth assessment process. The academic summary series tutor guidance is published every September. So we'll have a look at for an example of this in a moment, but at the end of every September, the tutor guide is published with a newer version with the practical activities updated for that series. Standardisation training is available upon registration of students for occupational specialism, and this training must be completed between September and February. This phase ensures consistency and fairness in assessment practice across different assessors. As well as in the January, February or term 2, you do also need to create your PA, so your practical activities schedule, outlining overall what timings and days that you will be completing the practical activities. So for example, for the first one, so the CPA schedule, so the assignment 2 part 1, you have maybe student A come in at 9 to 10:30 on the Monday of the first day of the assessment window. This is then followed through to student 2 at say 10 to 11, straight through, and then depending on your cohort, this might fall into a second day. So these schedules must be created and be ready should they be requested. April to June, internal assessments will take place during this period. June to July, sampling and moderation activities will occur where a subset of student submissions will be reviewed to ensure alignment with assessment standards and criteria. And in August, results will be finalised and moderation feedback will be provided to providers, offering insights for improvements and ensuring the integrity of the assessment process. Here we have the approximate guided learning hours for the occupational specialism components. Note these are higher than the GLH for the core content. This reflects the higher level and complexity of the knowledge and skills to be delivered. You should accommodate for this and your placement hours in your planning. So as mentioned earlier, you have the tutor guidance that a new version comes out every September. So this will be by the end of September. So in your supporting materials section, if you scroll down to the support and healthcare guidance, and this will drop down and you can see, for example, our most up-to-date version is the live version for 23-24. So that's for this summer series. And then in September, a new one will be published below that. Where this will change will be, for example, so as an example of what will change is, this is from page 10, is the below practical activities apply to occupational assessments to be sat in summer 24. So these are, every September we give you the CPAs, which is the core practical activities, and we give you the OPAs, which is on the following pages of this, for your occupational practical activities. So this gives you an indication of what areas are going to be assessed and how long each of these tasks will take. So what does this mean? If you go past these pages here, you will then come to a breakdown. So we know from the summer 24 series that CPAs 8 is going to be assessed. And what we've highlighted further down in the guidance is an overview of what this could cover, but we've also broke down the skills and knowledge that will be assessed. So across these skills and knowledge, the students will be assessed. So this will really help you in planning for formative assessment for assignment 2, exploring different ways against these skills and knowledge that you can assess students from a practical perspective. Inside the tutor guidance, you'll also find all your marking grids and descriptors as well for each of the assessments. That means you can utilise them now to start creating assessment rubrics in order to assess student progress. So what else should be incorporated into the delivery? So there are several other crucial elements. For example, professional behaviours. So integrating lessons on professional conduct and ethical principles ensures students are prepared for the workplace and adhere to industry standards. Offering sessions to enhance students' literacy, numeracy and digital literacy skills strengthens their overall competency and employability. Implementing regular formative assessment provides ongoing feedback to students, helping them track their progress and address areas for improvement. Encouraging students to synthesize information from various sources fosters critical thinking and problem-solving abilities, essential for success in the healthcare setting. Providing support and resources for students who need to retake Year 1 content ensures they have the necessary foundation to progress in their studies. Offering dedicated sessions to prepare students for assessments, including practical exams, revision techniques and study skill workshops, enhance their confidence and performance. Assisting students with their UCAS applications or apprenticeship applications and interview preparation equips them with the skills and knowledge to pursue further education or employment opportunities. Equipping students with academic skills such as research methods, referencing, and critical analysis prepares them for higher education and lifelong learning. So this is just some of the list that we have shared from other providers. This isn't an exhaustive list, so please feel free to explore what other ideas that you think should be included in your planning. In your approach to curriculum planning, creating themes to link content areas is a strategic and effective method. By identifying overarching themes that connect different subject areas, you can foster interdisciplinary understanding and coherence in the curriculum. So let's explore an example of how to do this. So the curriculum themes that we're going to explore and how to create that for curriculum planning, we're also going to look at how we can use that to prepare students in formative assessment. So to begin with, step 1, begin by collating the headings, so those grey headings in the performance outcome. So that involves gathering all the key headings or topics covered within each performance outcomes. Step 2, group these headings together into overarching themes. By identifying common threads or concepts across different performance outcomes, you can create cohesive themes that connect various areas of knowledge and experience. So that's you've now created a theme, a curriculum plan, a design of what order and how all the knowledge and skills be linked together. So now you can start creating formative assessment that then matches the themes of your curriculum plannings. So you could create a scenario or context for students to apply their knowledge and skills. This could take the form of a skills session, case study, or a series of tasks or questions that challenge students to integrate their learning within a real world context. Finally, throughout, you want to facilitate opportunities for student reflections on their experience and learning outcomes. Providing a structured performer or framework for reflection allows students to critically evaluate their performance, identify areas for improvement, and make connections between theory and practice. Enriching learning experiences is essential for fostering deep understanding, critical thinking, and long-term retention of knowledge. By incorporating diverse and interactive activities, you can engage students in meaningful ways that go beyond traditional instruction methods. So let's explore some examples. Linking to placement. So linking classroom-based learning to placement experiences enriches students' understanding and application of content areas. As students progress through each lesson, they're encouraged to incorporate examples from their placement, enhancing their comprehension and connecting theory to practice. One effective strategy is for students to use their placement experiences to create their own scenarios. By drawing from real-world situations encountered during their placements, they can develop relevant and practical scenarios that align with the tasks at hand. To deepen their learning, students can exchange scenarios with peers and apply them to assigned tasks. Through this process, they not only gain exposure to different perspectives, but also refine their critical thinking and problem-solving skills. Peer assessment becomes a valuable component in this process as students evaluate each other's works against the grading descriptors of the synoptic assignment. This fosters a collaborative learning environment where students learn from each other's strengths and areas for improvement. Moreover, engaging in this iterative process provides students with the opportunity to enhance their feedback and reflective writing skills. By reflecting on their own work and providing constructive feedback to the peers, students develop a deeper understanding of their learning journey and continuously strive for improvement. Integrating placement experiences into teaching and learning creates a cyclical process where each component informs and enriches the other. Let's explore this interconnected cycle. So during placement, students gain first-hand vocational knowledge and develop practical vocational skills in real-world settings. They have an opportunity to then apply theoretical concepts learned in the classroom to authenticate situations, gaining valuable insights and experiences. The knowledge acquired during the placement serves as a foundation for classroom-based learning. Students bring the experiences back to the classroom, enriching discussions and providing real-life examples that enhance their understanding of theoretical concepts. Similarly, the vocational skills developed during placements complement classroom learning. Students refine the skills in practical settings and then apply them to classroom activities and assignments, reinforcing their learning and deepening their expertise. Finally, the synoptic assignment serves as a culmination of this integrated learning process, drawing on their placement experiences, vocational knowledge, and skills acquired throughout the programme. Students demonstrate their ability to synthesise and apply their learning to complex tasks and scenarios. This cyclical relationship ensures that each component informs and strengthens the other, providing students with a comprehensive and holistic experience. By bridging the gap between theory and practice, integrating placements into teaching and learning prepares students for success in their future careers. Now, to effectively bridge knowledge and skills acquired during placements, we propose or suggest creating a placement skills checklist. So this is an example that I have here. So the checklist serves as a tool for students to consolidate their understanding and application of both theoretical knowledge and practical skills. Students will use this checklist to indicate the level of comprehension and experience with each item. They'll note whether they understand the concept, discussed it during placement or class, observed it being performed, took part in the activity, or completed it independently. Following completion of the placement, students will engage in reflection and analysis. They evaluate how they demonstrated each knowledge area and skill, identifying strengths and areas for improvement. This reflective process enhances their self-awareness and facilitates deeper learning by connecting theoretical concepts to real-world practice. Another strategy you can explore is learning stations. They offer a dynamic and interactive approach to teaching and learning, designed to engage students and reinforce key concepts. Here's how they work. So first you need to divide your classroom into 4 sections, with each section representing a learning station. Students will rotate through these stations into small groups, spending a set amount of time at each one. At each station, students will encounter a unique method of teaching a skill or concept related to this lesson. For example, at the creating presentation station, students may be tasked with developing a presentation on a specific topic related to the lesson, fostering their research and communication skills. Reading and evaluating an article station challenges students to critically analyse an article relevant to the lesson, honing their ability to assess sources and extract key information. Completing a practical or simulation session station, students engage in hands-on experiences or activities or simulations that allow them to apply theoretical concepts in a practical setting, enhancing their understanding through experiential learning. At the tutor presentation station, an instructor delves a focused presentation on a key concept, providing additional insights and clarification to supplement the student learning. So on completion of these 4 stations, the final station will allow the student to reflect. So the final part of the session will allow the student to reflect with an opportunity to reflect on their experiences through learning, consolidate their understanding, and identify areas for further exploration or improvement. By rotating through these diverse learning stations, the students receive a well-rounded and immersive learning experience that caters to different learning styles and preferences. This approach fosters active engagement, collaboration, and deeper understanding. Learning stations can be seamlessly adapted into formative assessment stations, aligning with the different format of occupational specialism assignments. Each formative assessment station offers a unique method of assessments tailored to students' individual learning needs and the requirements of the occupational specialism assessment. So again, you would have 4 stations. At one station, students may engage in creating a risk and creating a healthcare plan. Another station might present case studies with themed questions or written clinical stimuli. The third station might have a practical session or station, provide hands-on opportunities for students to demonstrate their practical skills. A fourth station might have a professional discussion with the tutor, offering the students to engage in meaningful dialogue, sharing their experiences in relation to the content. And finally, once all 4 stations is completed, a formative assessment at the end will allow the students to do some peer marking reflection, so using the marking criteria that aligns with those different synoptic assessments to do some peer marking against them. And this is an opportunity for students to give constructive feedback, but it's also an opportunity for students to reflect on their learning journey. So further strategies to prepare students for synoptic assignments. To effectively engage students and foster higher order thinking skills, educators are encouraged to shift towards inquiry-based learning situated in real-world application. This approach aligns with Bloom's taxonomy, where higher order thinking skills, or HOTS, are constructed from the top 3 levels of the taxonomy. Learning experiences focusing at the top of the taxonomy emphasize problem solving, generalization, and critical thinking. One effective strategy to achieve this is through evidence-based practice, or EBP, which is a common strategy in health academia. EBP involves integrating a clinical experience, patient values, and good research evidence to inform decision making. Problem-based learning, or PBL, is another valuable approach to promoting HOTS. Group activities such as discussions, peer tutoring, and cooperative learning are effective in the development of HOTS. There is a strong correlation between problem-based learning and the development of higher order thinking skills. By incorporating these strategies in teaching practices, educators can create learning environments that encourage students to critically analyse information, draw conclusions based on evidence, and apply their knowledge to real-world situations. So we're now going to explore key development areas from the Year 2 assessment. So we're going to delve into the Chief Examiner and the Moderator report in more detail. So beginning with the Chief Examiner overview for assignments 1 and 3. So overall, students excelled, especially in marks band 3 and 4 for assignments 1 and 3, showcasing a robust understanding of the subject matter. Students demonstrated a solid comprehension of patient care and risk management, reflecting a good understanding of risk factors. The students' impressive knowledge was reflected in their grades, indicating a well-received understanding of course content. Students showcased a person-centered care approach by setting appropriate goals aligned with the scenario. Students provided high-quality answers, particularly in task 1 and 2, demonstrating a progressive understanding of the subject matter. Some students struggled with evaluating the impact of goal setting, indicating room for improvement in evaluative interventions. Suggestions were made to enhance language awareness and question skills to improve evaluation. Students faced difficulties in responding to practice-related questions, especially linking them to professional boundaries. Students performed well in understanding physiological observations, showcasing confidence in their comprehension. Students excelled in reflecting on their scenarios, showcasing relevant knowledge, skills, and behaviour. And enhancing terminology discussion and questioning skills can improve performance. So let's take these key themes and apply them more specifically to the assignments and dig a little deeper. So let's explore assignment 1 first of all. The scenarios enabled students to understand assessment, goal settings, care, and treatment plans progressively. So for task 1, assessment of patients or situation, students responded well, addressing Martha's immediate needs and assessing risk factors effectively. Task 2, the goals, patients, and outcomes. Students set short-term goals for Martha's daily living effectively, emphasising person-centred care. For task 3, the care treatment support plan task, students summarise main concerns for Martha and develop treatment and support concepts. And for task 4, evaluating monitoring and effectiveness. This task, students struggled with evaluating care plan outcomes, indicating a key area for improvement. So overall, assignment 1 just demonstrated students' understanding of assessment, goal setting, care and treatment plans. The need for effective professional involvement enhancing Martha's well-being. So these task themes, task 1 to 4, they stay the same every year, just the patient and the context and the case studies change. So I hope you've been able to identify key areas and themes that you can support in your student development for assignment 1. Now assignment 2 in a bit more detail. So the scenario revolved around emergencies, infection prevention control, well-being assessments and clinical tasks. Students demonstrated varying degrees of effectiveness in following infection control procedures, and with some excelling and others struggling. Effective communication and comprehensive documentation were crucial for higher grades. Challenges included ineffective PPE usage, missed signs of deterioration, and incomplete documentation. For scenario 3 and the urine sample collection, challenges involved hand washing, infection prevention control, and accurate recording. Students approached scenarios with varying levels of confidence, showcasing their adaptability. Effective incorporation of resources into discussion was crucial for better performance. Strong interpersonal skills and person-centered care approaches were essential for effective communication. So assignment 2 highlighted the importance of infection control, communication skills, proper equipment usage, and adhering to person-centered care in achieving higher grades. Now let's explore the moderator's overview of assignment 2. So as we're aware, each activity involved a unique scenario, allowing students to plan effectively before starting. They utilised this preparation time to support their practical work. Student responses varied in confidence levels, with some displaying nerves and needing encouragement, while others were well prepared and confident. Students attempted completion of associated records, but success varied. Planning time was effectively used to understand guidance and create notes, impacting assessment outcomes. Assessors used templates to capture observations, with better examples providing detailed account. Some concerns were raised about assessors becoming overly involved. Concerns were raised about the adequacy of planning and input provided to students before assessments, suggesting potential gaps in preparation. Provided resources were effectively used, especially for activities where they were integral. However, completion of performers varied in detail and effectiveness. Students struggled with accurate Braden score calculation activity, impacting the quality of care plans. Effective utilisation of resources such as the Eat Well guide informed recommendations for dietary improvement. Most students attempted the checklist, but the level of detail was varied. So overall, the moderation process revealed themes related to student preparation, confidence, resource utilisation, assessor's role, planning and input concerns, accurate assessment parameters calculation, and varying completion levels and assessment records. I hope you've now been able to identify some key areas to develop for assignment 2. Now let's explore assignment 3 in a little bit more detail. Student grades reflected their classroom and placement experiencing, showcasing their understanding and development. In regards to the themes, theme 1 for this year was supporting effective working and communications. So students demonstrated a strong understanding of teamwork, safeguarding practices and professional roles. Theme 2 this year, working within codes of conduct. Some students struggled to apply codes of conduct to their clinical environment, while others effectively related them to practice. Theme 3 this year was understanding physiological observations. Students excelled in discussing physiological observations, demonstrating confidence in their understanding. Students effectively showcased their understanding and practical experience, reflecting on their learning journey. So assignment 3 emphasised the connection between classroom learning, practical experience, professional roles, and the application of codes of conduct to practice, contributing to high grades. So that is our overview of the assignments, and I'm hoping that you've managed to take some key development areas from assignments 1 to 3. Now let's explore resources to support you in delivery. In our mapping documents for our health occupational specialisms, we've identified a significant overlap in key areas such as legal, policy, regulations, health and safety, and safeguarding. This holistic approach to teaching not only allows students to make connections across different aspects of the curriculum, but also supports educators in delivering comprehensive and integrated lessons. You can find these occupational maps in the teaching materials tab of the qualification page. Please explore the different OSs depending on which one you're delivering. The lists that are in these mapping documents are not exhaustive and would be treated as more of a starting point for you in regards to mapping. A new toddler textbook is set to be published on August the 30th to 2024, specifically designed to support the delivery of the T-level adult nursing occupational specialism. This resource aims to provide comprehensive content and guidance to educators and students, enhancing the learning experience and facilitating effective delivery of the curriculum. In summary, our presentation has provided an overview of the assessment landscape with the T-level health programme. We have discussed synoptic assignments, assessment timelines, internal assessment milestones, guided learning hours, assessment preparation, insights from the Chief Examiner overview, and the moderation process. Through these assessments, students can evaluate their knowledge, skills, and competencies across various health aspects, ensuring they are well prepared for future careers in health. By emphasizing continuous improvement and the integration of theory and practice, you can strive to deliver a comprehensive and effective assessment experience for our students. Please take a moment to review the summary in a little bit more detail. If you feel like you've missed any of these details, please go back and revisit that section of the video. Please take a few moments to complete this feedback form. Your insights are very invaluable. Your contribution will be anonymous, but it will help support us in delivering future CPD sessions. So to summarise, we have successfully achieved our aim of supporting you in the delivery, planning and preparation of students for Year 2 occupational specialism. We have identified various approaches to curriculum planning and delivery. We have explored a range of teaching and learning strategies, and we have shared best practice and formative assessment. Overall, by addressing these key areas, we've equipped you with tools and strategies needed to effectively support students in their Year 2 occupational specialism. Thank you for watching our T-level health preparing for Year 2 delivery recording.